Welcome to Martin, South Dakota, the seat of Bennett County and home to just over 1,000 people in southwest South Dakota. With a diverse heritage of farming, family, spirituality, and native peoples throughout the region, Martin is a beautiful and representative corner of South Dakota that you've probably never been lucky enough to have ever heard of. With your participation in the REPS program, however, that could soon change as you spend a portion of your summer here or at locations similar to Martin, learning what it's like to practice and care for others in rural South Dakota. People here work hard, but they also have fun, spending time in this idyllic countryside, golfing, fishing, and gathering together in a community where people know and look out for one another. Founded in 1979, South Dakota's Area Health Education Center, the parent program for the REPS Summer Experience, was begun with the purpose of connecting talented health professionals to rural communities where they can make a difference. This is what your time with us can do for you, as you, alongside your interprofessional partner, connect with and serve others while discovering what kind of lifestyle and worthwhile careers are available in the more remote places across our state. Now let's hear from some of the providers at Bennett County Hospital, Martin's critical care access hospital where students learn during their time in the program, about some of the pros, cons, and responsibilities of healthcare providers in locations just like this one.
Yes, I am Desiree Moreland. I am a pharmacist, the pharmacy manager here at Bennett County Hospital. I joined Bennett County in September of 2017, so I've been here almost 3 years. Very busy hospital for as little as they are. They see a lot, they do a lot. You get to learn a lot being on a facility like this. We are positioned in between two reservations. The types of patients, the types of cases we see can vary much more than what I would see just 30 miles away. When I joined, we had a lot of goals. We as a facility, the hospital board, the administration, and myself met, and we set a lot of goals for our facility. There were a lot of changes we needed to make to get us up to speed, so to speak. The first one was to remodel the pharmacy. It was previously just a one room, like a closet. We came in, we remodeled a whole area. We remodeled our medication room. Everything when we came in was just the medication bottles. We planned on implementing automated dispensing machines. So first we had to unit dose all of our medications. So each medication is labeled correctly with the barcode. When we came in, we implemented a more active barcoded medication administration system. So each medication is scanned. Patients were scanned. We went from about 40% to a 90%-ish scanning rate, so that's a great improvement over a year. After that, we applied for a Helmsley grant through the Helmsley Foundation, and we did receive that. So they helped us purchase an automated dispensing machine, and also on top of that, we implemented e-pharmacy services. So now we have 24/7 pharmacy coverage. I do respond to codes anytime there is a code that makes it to our facility. Pharmacy is hands-on. We jump right in, and with the pandemic, it's a little different, but we get in right in there. We draw up medications. We anticipate what they may need next, and we have that drawn up and ready for nursing to administer. We respond to traumas when we're in-house. And we respond to intubations, so we're right there with the nursing staff drawing up medication, dosing medication, providing drug information for the providers and the nursing staff. So we also are the long-term care pharmacy for the nursing home. Here we don't have a lot of staff in rural hospitals, so we all tend to wear a lot of hats. And that being said, we all know each other's weaknesses and strengths. So when we get together for codes or traumas, we know what to expect out of other people. We assign our roles and we know what we need to do. When I came in, we implemented an antimicrobial stewardship program, which is pretty huge. It's been required for a while now, but we got that up and going in 2018. We introduced antibiograms to our facility. Our reference lab had been providing them, but we provided education on how those are applicable and how you can use them in your prescribing practices. When you're in a smaller hospital, You as a pharmacist, you get to be involved in as much as you want to, as much as you can. You really can just expand your wings and fly. We are also involved in a pharmacy and therapeutics committee, so we're involved with the formulary, any drug shortages. We really just, you can get it as hands-on as you want to, and that's something not a lot of pharmacists in bigger facilities get to do. They don't get to learn and see and do these things that we get to do in rural America.
Chad Sarda, I'm a physician, MD. In Pierre, I'm a veterinarian also. That's what I did first. I went back to school. Been coming down here for about 7 years, I think, close to that. ED director in Pierre, and also the medical director in Gettysburg. And then I oversee some ambulance services, several around the state. I'm a flight surgeon in Sioux Falls, the Air National Guard. Those were surgical suites in the back that are the ER now. We've gotten a CT scanner, so that was new since I've gotten here. Used to be if you had a head injury or some other potentially surgical thing, abdominal pain was a problem. You kind of had to watch them or send them out, and so there's a lot of transfers that maybe didn't need to be done. So that's been very helpful, or identifying, traumatic injuries. So CT scanner, new EMR, it was all kind of paper, so that was new. A lot of different medications. There's a glide scope here now with helps with intubations. And they do everything here. It's, trauma-wise, chest tubes, whatever needs to be done. So, and it's kind of fun to oversee, PAs, nurse practitioners, and kind of let them practice at the top of their license, which I think everybody should do, as long as you're well-trained and well-read and you're confident that you know what you're doing. And if you don't, you know to call somebody. I think that they do a very good job in most of these small places that I work with, and I try to bring up cases to them, and whether it's high-risk cases or medical legal stuff or whatever it pertains to, just so they have some idea of how to keep themselves out of trouble, which also keeps patients out of trouble. And try to do things locally, things like paracentesis. There's not a reason to have to transfer a nursing home patient who needs repeat paracentesis once a month or something on a 5-hour trip or more, when it can be done locally as long as you know what you're doing and have been trained to do it. So it's just kind of fun working with all these people in different ambulance services. So I get calls fairly frequently from them about different clinical cases and whether they need to be transferred to the emergency room or the hospital, or what imaging they might need or follow-up stuff. The CEOs here have been easy to work with. They handle the administrative side and then kind of trust us on the medical side. And if we have recommendations, like the CT scanner was one thing where it was like, is that really going to make financial sense? Do we need it medically and whatever? So that worked out well. The ventilator, the glide scope, all those things. I think that the mid-levels at work here, coming in, knew kind of what they were getting into. And so you're a long ways from anywhere, and anything can happen, and you've got to be comfortable with that. I bring up cases to them every time of stuff I've seen in the ER in Pierre, or hear from Gettysburg or Pine Ridge or Rosebud, or the flight team in Rapid City that I work with. There are times when they'll call me and say, I've got this patient, and they've got XYZ and whatever, and we talk through it, and it might be one of those where I'll say, well, I think you can probably admit them locally, and I think that they do probably keep more things here locally in the hospital than most small places do, or at least a lot of small places do, because they've just become more comfortable with knowing what they can do and knowing that they can always call somebody. You're taking care of your own family and your friends, and you know everybody essentially. I think that's why they're devoted and show up, because they're taking care of their own community.